Well, hello and welcome. You're watching India Fights Back with me, Rajat Kain. Well, as the numbers of COVID positive cases are seeing a steep rise across the country, Vice President Venkaiah Naidu and Prime Minister Narendra Modi held interaction with the governors and the lieutenant governors of the states and union territories. Well, Vice President Venkaiah Naidu called for encouraging and enforcing COVID appropriate behavior that has helped us to curb earlier surges and also for implementing the time proven and reliable strategy of test tracking, and treating with renewed vigor. Well, addressing governors of all the states virtually along with Prime Minister Narendra Modi, the Vice President underlined the spread of the virus can be controlled with support of community and stressed the need to constantly focus public attention to this vital aspect. Well, it's important here to underline that this meeting, the virtual meeting of Vice President and Prime Minister with the state governors and Lieutenant Governors of Union Territory comes few days after Prime Minister Modi held video conferencing with the Chief Ministers where he urged not just the state government but also public at large to follow COVID appropriate behavior. Well, so how important therefore is it to follow COVID appropriate behavior and also for the states and other administrations so as to enforce these behaviors, at the same time responsibility of the public and of course like for the state when it comes to the vaccination, where are we and how important is it therefore to vaccinate people who are of the target age group. For time being, it is anybody and everyone above 45 plus. Well, we're joined with our panel of two important guests, Dr. Sunil Raina. He is Professor and Head Community Medicine from Dr. RP Government Medical College, Tanda. Many thanks for joining us, Mr. Raina from Himachal Pradesh. And Dr. Rana A.K. Singh, Medical Superintendent and Director, Ram Manohar Lohia Hospital, Delhi. Many thanks, Dr. Rana A.K. Singh. Pleasure to have you on the show as always. Let me start with you, Dr. Singh. Sir, given the current spike, how important, as we keep emphasizing and as experts, you've always emphasized on COVID appropriate behavior, it is to drive home the point here that there is no alternative to COVID appropriate behavior and how important therefore it becomes to follow these few important things.
Well, before we talk about the importance of COVID appropriate behavior, I would like to overemphasize and bring to the notice of all my viewers that catastrophic potential or lethal potential of COVID-19 infection is known to the world. We'll have to go back in time roughly a year from today, and we have seen the quantum of death which this disease inflicted on the people of the richest and mightiest of the countries, say America, say Brazil, say Europe, France, Germany, Italy. So, and we did not get that kind of, like onslaught on our people.
Right.
Why? It's a multifactorial phenomena. One, probably the most important phenomena is that our Honorable Prime Minister, he acted in time and he took a decision which was a tough decision. The people had to face the inconvenience of that decision. But then at the end of it, we could not see that kind of catastrophic or holocaust of this virus on our population. So, and how we could contain this disease from, we had brought it from a very high level to near zero level. I am telling you, if we go back in time a couple of months, it had really touched Nadir. It had really gone to a position that I may confess in front of you and my viewers that I had a wishful thinking that probably Corona is exiting once and for always. Unfortunately, it didn't happen. So if we analyze that, why did it happen? Why it was there? Why did it come down? And why it is going up again? Probably we have diluted. I mean, it was a very easy visual to be seen once you step out of your house, once you step out of your office. It's not difficult. The people had really lowered their guard. People were wearing masks, but it was, hanging in the neck. People were wearing masks, covering the face, not the nostril. So we had really lowered our guard. And now we are facing this second surge. And this surge is really, like it's frightening. I'm telling you, I hate this institution, Ramanolaya Hospital. This
Mm-hmm.
surge is frightening. The number is really increasing. I mean, like very rapidly. So what do? We have to do everything to bring it back to the
Right.
zero level, which we could achieve. We had one weapon, that social vaccine, that is corona appropriate behavior, mask, hand sanitization, and social distancing. And on top of that, we have got a very, very effective and very, very important weapon to contain this disease, that is the vaccine. So, if we add these two weapons religiously, rigorously, then believe me, if you can, we will bring it down to the level when it will start exiting from our country and the society. But if we take this disease for granted, if we do not really religiously and rigorously follow those
Mm-hmm.
norms, then the result could easily be catastrophic.
Right. That's really important. So this is, that is what experts keep emphasizing. And there we have Dr. Rana A.K. Singh. He's heading one of the top institutes of the country in terms of medical sciences and healthcare. And he's the one, just bringing perspective to the second wave of COVID-19, which is fairly serious. That if we compare in terms of numbers and the steeper rise of the first wave. Well, Dr. Raina, let me just start with you here. Let's begin with what is situation in your state to begin with, in Himachal Pradesh, or to say in your city. Are the numbers rising with the same intensity, and how important therefore it is to follow these very important COVID appropriate behavior? And alongside that, what is the picture about the vaccination at your center?
Rajat, if you look at my state, or even in my state, the numbers are increasing the way they are increasing across the country. And we are more or less mimicking what we had last year. So last year we had the infections coming in high numbers from particular states, say for example, Maharashtra. We are again having high numbers coming from Maharashtra and then spreading out to the country in different parts of different states of the country. Now we are seeing an upsurge too. The district is seeing an upsurge too. But we need to realize that Dr. Singh correctly pointed out, how did we reach the numbers that we reached in February? How did we reach those small numbers? There were two important things, as he correctly pointed out. One was that the government was very decisive. It came up with the lockdown. It imposed restrictions, came up with guidelines. But very importantly, the people appropriately responded to them. The response of the public to the guidelines, to the restrictions, to the lockdown was very sound and critical to make it happen, that we were able to reach the small numbers. Now, over a period of time, we have been able to add vaccination to this arsenal of restrictions or social distancing or masks. We have been able to add vaccination to it as well. But let us understand the time we are in now. The numbers are increasing in huge surges there of numbers. So as the numbers keep increasing, the chances of vaccination becoming less and less effective are more. Why that is going to happen is that as the numbers will increase, we will see more and more mutations. And once we see more and more mutations, we are having higher chances of making or rendering vaccination ineffective. So we need to vaccinate fast, critically as soon as possible, to ward off the fact that vaccines will be rendered effective maybe 6 months or 7 months from now. That is one part of it.
Okay.
But second and very important part of it is that we again need to resort to what we have been doing in the last year, following the COVID appropriate behavior. If you look at this, unless and until we go back to that COVID appropriate behavior and respond to the guidelines the way we had been doing in the last year, we are not going to reach the numbers that we want as soon as possible. This is the same across the country. Some states are doing it. Some states are reaching the peak or the surge, maximum surge much earlier. Maybe, for example, Maharashtra is at the peak, but other states are bound to follow. And if we don't act now, we are in for a problem.
That's important. If we don't act now, we are in for a problem as numbers keep rising in the second wave. Dr. Rana A.K. Singh, let's dissect this second wave further in terms of the variants. How important, or you say the ratio of variance to the cases added every day, how much does that proportion hold? There are reports that there have been a lot of patients in Delhi who have been tested COVID positive, and they have shown the presence of UK strain as well. So how important is it therefore to counter these strains, or at least to have strategy to counter these strains as well?
I mean, if we are, looking at the different strains, mutations and genetic changes, in the life cycle of a virus is a known phenomena. If this virus has to exist, this is out to mutate. And, like different strains, the virus with different genetic composition, it is out to evolve. So we are getting results of other strains, but still it is not in a very large number. That number is still very small. So what I personally believe, that instead of thinking about the strain like strain X or strain Y, most important thing is, no matter which strain it has to be stopped from entering and infecting the people at large. And as I said, we have got only two time tested. Of course, the vaccination is only, say, 3 months old. But the social vaccine, now it is time tested. We have tested it over a year, and we have found this to be very effective. So rather than thinking which strain, no matter what strain it is, if we don't allow it to enter in our body, if we don't allow it to infect us, then we are winner. So rigidly following the COVID appropriate behavior, and try to get the vaccine as soon as your turn comes. There is a group you have already said beyond 45, and if we combine them, we would be victorious. A lot of things are people saying, will this vaccine be effective against the other strain or not? These are the questions that will require some time. I have simplified it for myself. If we look at the vaccination, the first vaccine against smallpox was was made by Sir Edward Jenner. He did not use, human pox virus to develop that vaccine. He used cowpox virus to develop that vaccine, and that vaccine has eradicated smallpox from the rest of the world. So we should be hopeful that this vaccine will be effective against the mutant variant also. And let us also not forget that our scientists, our research labs, they have been able to evolve the two vaccine in a record time. That's a time which is a benchmark for the rest of the world. The other part of the world has not been able to develop that. So if the scientists could develop these two vaccines in such a small time, if required, they can easily modify, would be able to do some modification in the same vaccine so that it becomes effective against the other strains also. So, in a nutshell, rigidly following COVID appropriate behavior, getting oneself vaccinated as soon as your turn comes. And now we have got addition of the third vaccine also, because India is a very vast country, like 130 crore people. So to vaccinate, that kind of, people is not an easy job. But because we have got one more addition, so more will be merrier. If we vaccinate more, we would be able to contain this disease.
Right. Dr. Raina, it's often said, and you also underlined that, if we don't, act now, of course, like we are in for a trouble for a long run. Is there a feeling among medical fraternity that the gains or net gains that were achieved in during first wave, to say off, as numbers started ebbing post November, that somehow seems to have been compromised with? People got a little complacent, or for that matter, there was in general feeling, let's start with the normal living. Let's start, just venturing out. And therefore, perhaps COVID is over. Khatam ho gaya hai, khatra nahi hai. Were these the factors which has led to the second wave?
Look, Rajat, we need to see it in a broader perspective than just calling it a compromise. Now, every time a pandemic is there, or a disaster or a catastrophe of this magnitude is there, we also need to take into account the vulnerables of the society.
Right.
So if you look at the broad societal distribution, 30% of the population is always vulnerable. They will have problems whenever disasters struck or pandemics strike or catastrophes like this will strike. So this 30% is something that we also need to take care of. So compromises maybe because of the fact that we were worried about these 30% have happened, but that is inevitable to happen. That is one part of it. Second part of it is that a response fatigue set in. If you are asking people to go with a public message that is constantly delivered into their ear from day one updates, it being delivered, the fatigue sets in. So people get bored of it.
Right.
The third thing is that over a period of time, when restrictions were not there and when restrictions were lifted, we put into the system a group of people, the youngsters, the kids, the office goers into the system when restrictions were lifted. Now, this population has very small attention span. They have a lesser attention span as compared to the elderly people or the older adults. So you have to sustain a message with them, which is repetitive and reinforced from time and again. Otherwise, a response fatigue will set in them very easily. So these 2-3 things might have happened, which would have somehow made the numbers to go up again.
Dr. Raina, like before I move to Dr. A.K. Singh, I'll ask the same question to him as well. So what explains, I know it's more to do with the science than just human behavior here. The numbers or rather proportion of youngsters happens to be the ones which are impacted more with the second wave. A lot of states have reported the nature of second surge has been such that more youngsters have been affected.
That is probably the critical part of the second wave. That is something that should worry us. That's why I said we are in for a trouble. Now, whenever a pandemic happens or when an infection of such a magnitude happens, first it takes care of the vulnerables, those who are at the highest risk of getting infected or dying from the disease. So if you look at the first phase, it were the elderly people who had the higher risk of dying, picking up the infection more frequently because of the fact that we thought that their immune system was compromised or was lesser than the younger ones. But the second wave comes and you see that there is mutations, there is change in the way virus is fighting you. It's because it's simple. The virus is fighting for its survival and we are against a virus which is fastly moving. It doesn't stay like the same for years together or months together or days together. Every time the number will increase, as I said, the number will increase, the virus will get the chance to replicate. And every time it gets a chance to replicate, there is every chance that it will mutate. Now, once you put in the system, the youngsters, it wanted to infect them, it got into them and replicated to infect them to an extent that it could move into a population which was susceptible at that point in time.
Right.
So that's something very worrisome in a pandemic. When infections move into the rural populations, when infections move into the tribal populations, when infections move into the so-called healthy group, pandemics are in a problem. Pandemics do create a problem. So that's something that we need to be worried about now.
Right. Dr. A.K. Singh, your opinion on this? The number of youngsters which have been affected by the second wave happens to be fairly more in a lot of states as they have reported than it was in the first wave. Your opinion, sir?
I'll tell you, Dr. Lokesh was saying very nicely that the fatigue is setting in.
Dr. Raina, okay.
Dr. Raina, sorry.
Yeah,
so
okay.
the fatigue is setting in. The problem is that let us look at a marathon race. The people who start overzealously, they get tired somewhere in between and they lie flat on the track. But the people who maintain the same steady speed and steam, ultimately they touch the red ribbon. So life is not a sprinting. It's not like 100-meter race. We will have to continue with the COVID appropriate behavior with sustained zeal. And then only we will be able to kill this pandemic once and for always. If we get tired, if we get fatigued, if we feel that, how long, we should take precautions. So it's almost like buying between life and death. So if we all compromise, this disease, this virus is a very deadly virus. And it can spare none. We do say that there's a vulnerable group, elderly people with comorbidities. They are more vulnerable to die. But as a professional, can we say that the younger people have not lost their life? They have also lost their life. So considering the virulence of this virus, considering the infectivity of this virus, considering the quantum of life it can consume, all of us will have to realize that we will have to do every possible thing in a sustained way to stop its propagation And we have got two weapons. We have been telling this time, like every now and then, COVID appropriate behavior and the vaccine, mask, hand sanitization, social distancing, and the vaccine. So we must combine these two weapons to win over this deadly virus.
Right, right. So COVID appropriate behavior alongside, we really have to understand that all of us are susceptible or vulnerable to this virus. There is no specific group that can say or can claim, okay, we have this natural cover, we are young or whatever, but so all of us have to take immense care of ourselves and of course like those who are around us. Just as we are about to close the show, Dr. Raina, your view, when perhaps we'll see the broad basing of vaccine. Currently it's confined to 45 plus. As they have been this discussion, there have been some opinions that we should have this vaccination for everybody. So will we be having this step soon so as to broad-based vaccine, or perhaps you have to wait for that?
I don't see it happening very soon. The broad basing of vaccines for all populations or all age groups. The reason being that you need to understand the supply chain mechanism of vaccines which work across the world.
Right.
If you're thinking of vaccinating 30 crores by the month of July, you need to see the numbers. You need to vaccinate roughly 50 lakh people every day if you are needing to touch 30 crore by July. And for that, you need to have a production capacity which is in excess of, you can see the numbers which has to run at a crores to develop those vaccines. Now, what will the arrival of third vaccine do? It may make it much more easier, much more faster, but I don't see this happening in May or June that we will be going beyond this broad basing over this. Now, there is another worry about this broad basing at this point in time. The broad basing in all population groups there is a worry about that as well. Because if we broad base at this point in time and our supply chain is not able to maintain the pace or the flow of the vaccines, we may be depriving those who are in need of the most. Remember, vaccine should be given to those who are in need than those who want, primarily because of the fact that we have a finite supply of vaccines. Vaccine supply is not infinite. We have a finite supply of vaccines. They need to go to those first who are in need than those who want the vaccines. Vulnerables first. So that's how I see it.
Absolutely. Dr. Rana Singh, your view on vaccination for all? I mean, in the sense, do we open it for all at this stage, or should we continue with 45 plus only, given like the logistics and given the supply chain?
I'm in total agreement to what Dr. Rana just said, that there is out to be a discrepancy or disproportion between the demand and supply. In a country like India, demand is going to be like any time larger than the supply. So if we can, let us imagine that if we can produce that many number of vaccine, if we can vaccinate that many number of people, that's the best thing to happen. But because of one reason, either the production or the supply chain or the vaccination itself, if we are not able to cope with the number, if we are not able to do it for all the number which we have in our hand, then absolutely I'm in total agreement, with Dr. Rana, that vulnerables should be protected first. So in total agreement to that concept or his views.
Right, absolutely. So clearly there we have these two experts listing out first the strategies and what we need to do in terms of human behavior and of course like the medical consciousness so as to fight this second surge, and also importance of vaccinating those who need at this stage, the vulnerable one, the target group, which is 45 year and plus. So clearly, every one of us has a duty in our hand first to protect ourselves and also to safeguard others around us. Many thanks, Dr. Sunil Raina, for joining us, and Dr. Rana Singh to be a part of this show. Well, once again, we appeal to all our viewers before we leave. Please follow COVID appropriate behavior. Here is our appeal to all our viewers. Keep following COVID appropriate behavior, keep wearing face masks, keep washing your hands 20 seconds at least. That's what the expert says, and do not forget to maintain physical distancing. Remember, these are small things that can help us in defeating this pandemic. Well, that's it in this edition of India Fights Back. Thank you. Goodbye.